Hi, everybody. Happy Friday. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
And Dr. Brian Ostick. I am Dr. Amy Ostick's husband and ER physician.
Nice new scrubs, Brian.
Thank you. They are my new figs. This video is brought to you by Figs, although
No, it's not.
not really. But Figs, if you want to sponsor this show, we're happy to discuss terms.
I like them too. I bought myself a couple pairs of figs during this pandemic, a couple pairs of scrubs, and they're very comfortable. They breathe. They're
Look
nice.
good, feel good.
Look good, feel good.
Oh, and before anybody comments on our Facebook video or YouTube, I'm not wearing my wedding ring today because I went golfing. I'm happily married. Calm down, ladies.
Why don't you have? Why? Who's at the golf course that you need to be
No, you swing.
not
and, I don't
wearing
want
a
it,
wedding ring for?
I don't want it compressing my finger, cutting off blood
Okay.
supply, or causing blisters.
All right, I'm not worried. Anyway, what we're going to talk about today is actually also can be read via my blog that I posted yesterday on the first of every month. I post a blog on my website, healthandhealingdpc.com, and I try to review. Recently, it's been mostly all COVID-related topics, and this month we reviewed kind of the update on the COVID-19 vaccine race, and really we probably will be seeing an actual contender here in the next few weeks. There's been reports now that the AstraZeneca vaccine in Oxford is almost ready to launch. They were probably the first ones in the race when we started the vaccine effort months ago. To date, there's over 169 vaccines in all phases of development.
Crazy.
11 of them, or 26 of them, were in human trial phases, and about 11 of them were in phase 3 trials, which is really this phase right before widespread distribution. So phase 3 is when phase 1 and 2 is really proving safety of the vaccine in the lab on animals, and then phase 3 they do it on human subjects in small numbers. And then also look for efficacy. So they give all these people vaccine, and then obviously some other people placebo, and they wait for those folks to become infected or be exposed to look at the efficacy of the vaccine.
Meaning, does it work?
Does it work? Right. Okay. So what I reviewed was just really that specific where we are in that in the immediacy of a vaccine. The best case scenario would be, it looks like that this vaccine, at least the ones that are soonest to come out to market or general distribution, will give us some level of temporary protection, maybe 3 to 6 months, and we may get it kind of like a flu shot every year. And so that's great news.
Sure.
Right? Enough people get this vaccine every year. It can provide a certain level of herd immunity.
Right.
And really we can start to gather, be together, open businesses up like we were before this virus. So the concern I have, and what I talk about in my blog, is something that the CDC brought up last year as one of the biggest health concerns facing our public health, and that is vaccine hesitancy.
Okay. What's that mean?
That means patients that are reluctant to staying on top of their vaccines, their scheduled vaccines. So meaning
like other stuff, not the coronavirus vaccine.
This is
like
even before coronavirus. Right.
Yeah.
Vaccine hesitancy is just that. It's people who are hesitant to getting vaccines. All the way from, the staunch anti-vaxxers that believe in conspiracy theories that there is some actual harm caused by vaccine, all the way to just people who are a little bit, don't feel like the flu shot works or something and don't get their flu shot every year. So for sort of mild concerns. But everything in between, what that amounts to is enough people not getting it and thus reducing herd immunity and making that vaccine effort, rendering it probably useless.
Right.
My concern is that will carry over into this COVID-19 vaccine.
Right.
And so what I've heard in my practice left and right and people in my community is like, well, why is this so fast? It's so fast. It's so fast. And the fact of the matter is this is not a polio time period, right? Or 1918 flu pandemic time period. This is 2020, and we have incredible technology available to us. There just wasn't money being thrown toward it or interest in it. So the technology was kind of there for us, and now we're just pouring all of our resources toward it so that we can utilize that technology and create a safe and effective vaccine. And a lot of these companies, as I write in my blog, are performing this research at risk, meaning they are massively producing this vaccine while they're also trying to prove efficacy. So they are financially putting themselves at risk, because if they have a vaccine that doesn't work, they've mass produced, 100 million doses that are useless.
Right.
So all that to say, this vaccine will be safe. It will hopefully be pretty effective, but it will be most effective if we all get it, and the right people get it, certainly in the beginning, because that is the secret sauce to vaccination programs. It is useless if we just give it to one person. That's not how that works, right? It works in a population in creating that herd immunity and protection.
Well said, and you really go into detail in that blog post about it. So if anybody wants to get a little bit more information, they can go to www.healthandhealingdpc.com and click on the blog, and you'll be able to see that information right there for you. If you're on our mailing list, you actually will get mailed the blog every month that you do, which gives updates.
There is a subscribe button on my website to get that. Be on that mailing list. You'll get updates on my blog posts and updates on our office and operations and everything else. Are you going to get the vaccine, Dr. Ostick?
I'll be first in line.
If they let you. Yeah, they might put some.
Women and children, second.
We're here for you. We're still doing, tons of coronavirus testing. LA County, we had a little blip last week. So we're hovering right at that 7 cases per 100,000 threshold, where we need to be in order to be bumped back down to the tier 2. We went from 7.3, now we're at 8.7, and we're just flirting.
We're close.
We're flirting with it. So stay diligent. All things outside are safer than inside. Wearing a mask reduces risk of transmission and getting it. And being in close contact with people also increases your risk. So choose things that are outside, that are spread out with a mask. That's going to keep us the safest.
At the driving range, I'll tell you, it's been kind of a nice little stress reliever for me too, to just get out. It's outside, you're socially distant.
Yes.
You hit a bucket of balls and you feel a lot better.
Good. I'm so glad you're feeling better.
Enjoy your weekend.
Yes. Have a great weekend. All call us 818-600-2426. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, make sure you share, comment, all that stuff helps us kind of spread this message that we're trying to get to as many people as we can. Thanks.
Thanks.